We're excited that you're interested in volunteering with us, and we will quickly go through an overview of our chapter and our programs and services, and invite you to join us as a volunteer. So I'll get started by telling you a little bit about the difference between Alzheimer's disease versus the term dementia. And dementia itself is not a specific disease. It's an overall term that describes a wide range of symptoms associated with a decline in memory or other thinking skills that are severe enough to reduce a person's ability to perform everyday activities. And Alzheimer's disease is a specific type of dementia, and it accounts for about 60 to 80% of all dementia cases. And Alzheimer's is a type of dementia that causes problems with memory, thinking, behavior. Symptoms usually develop slowly, maybe get worse over time, becoming severe enough to interfere with daily tasks. And one thing I want to is disease is not a normal part of the aging process, although the greatest known risk factor is increasing age, and the majority of people with Alzheimer's disease are 65 and older. But Alzheimer's disease is not just a disease for people of older age, and up to 5% of people with the disease have what's called younger onset Alzheimer's disease. You might have heard it used or called early onset Alzheimer's disease, and this often appears when someone is in their 40s or 50s. As of now, we do not have a cure or a preventative for Alzheimer's disease, but there are some treatments to help alleviate some of the symptoms of Alzheimer's disease. And as I'll talk briefly in a few minutes, there is lots of research that's going on to try to find a cure for Alzheimer's disease in our near future. Each year we release a facts and figures report. It's usually published in March of every year. These facts and figures are from 2015. Most of the facts and figures that we do see relate to age. You'll see 1 in 3 seniors dies with Alzheimer's disease or another dementia. It is the 6th leading cause of death in the United States at the moment, and it's the only cause of death in the top 10 in our country that cannot be prevented, cured, or slowed. We also see the rising costs associated with Alzheimer's disease and how it affects our country that way. The biggest that we found in 2015 is the lack of disclosure of a diagnosis of Alzheimer's disease to caregivers and or those with the diagnosis, compared to 90% of people with the 4 most common types of cancer have been told their diagnosis. So we have a lot of efforts to try to educate physicians and families to get a diagnosis as early as possible in the process. Another finding that we found within our facts and figures is how women are really at the epicenter of the Alzheimer's disease epidemic. We see that 2/3 of seniors with Alzheimer's disease are women. 1 in 6 in their 60s have an estimated lifetime risk for developing Alzheimer's disease, and also women in their 60s are twice as likely to develop Alzheimer's as they are to develop breast cancer. We also see that women are more commonly the caregivers for those that have Alzheimer's disease. So not only are they more at risk, they're also more likely to be the caregivers and care partners. We have some increases to the other top 5 leading causes of death in awareness and research. And because of that, we have seen that the deaths of those major diseases continue to decrease. This particular graph shows a 13-year period. You can see breast cancer, prostate cancer, heart disease, stroke, and HIV have all decreased. However, Alzheimer's disease continues to increase. So we do see that we have had some successes with other health related causes of death over the last decade or so, and if we can just mimic what they have done, we can see progress as far as Alzheimer's disease is concerned. So that is why we exist, the Alzheimer's Association. You can see our logo in the middle of our the words Alzheimer's Association depicts a person's profile, and it's next to what it kind of dips down into a beaker shape. And our mission states a commitment to advance research, enhancing support for all affected, and promoting brain health. And the underlying message of this logo is that we have a dual mission focused on people and science. And we provide programs and services at no cost to families, and we fund research that's vital to finding a cure for Alzheimer's disease. Here in Indiana, we are the Greater Indiana chapter. We serve 73 counties, and you can see in the graph there to the left the different counties that we do serve. We also know from our facts and figures that more than 110,000 Hoosiers have Alzheimer's disease, and also 132,000 people in our state are caregivers. A little bit more information about our chapter, our total revenue. You can see how that's broken down there. There's lots of opportunities to volunteer to help us raise money so that we can fund all of our free complimentary programs and services. And then nationwide, there are about 82 chapters across the country. And again, we are the Greater Indiana chapter. We have 73 counties that we serve, and we divide those up into what we call service delivery areas. We do have 3 offices in our chapter territory. Indianapolis is our largest. We do have an office in Fort Wayne and also in Maryville. And switching gears a little bit, telling you a little bit about our programs and services that we offer at the Greater Indiana chapter. First and foremost, we do have a 24/7 helpline that's available all the time. And if you don't remember anything else, please remember that we do have a helpline that's available to answer any questions or concerns about memory loss or Alzheimer's disease. That's 800-272-3900. And we also have statewide support groups available to caregivers, and care consultation where families can meet one-on-one with a social worker and help develop a comprehensive care plan. We have education programs statewide to better educate our community about Alzheimer's disease and the warning signs of Alzheimer's disease, and it kind of goes more into depth too about what to expect, legal and financial planning, and so forth. We have many fundraising events throughout the year to help us provide funds to support those programs. We also have many opportunities for advocacy and clinical engagement. We also have several different types of online services so people can be better educated and find support online as well. And we have quite a bit of funding toward research through not just our chapter, but through our national initiative. And each of these areas does have different types of volunteer opportunities, and we'll talk about that in the secondary video more in depth. I'm going to talk a little bit about some of the areas that don't currently have volunteer opportunities that may likely have volunteer opportunities in the future, but at the moment, I just wanted to let you know about these other programs and services so that you can be better educated about our program offerings. Care consultation, I mentioned on the last slide. We do have that broken up into 2 different levels. So if someone calls our helpline or walks into one of our offices, they can meet with a staff member and or talk with them over the phone and get general questions answered about local resources in their area. Maybe they're trying to find a geriatrician in their area. And then also level 2. Level 2 consultation is more comprehensive. It helps develop a care plan, as some families may need to know what next steps to take, and our licensed social workers really help the families one-on-one with that. Education program, opportunities for volunteering here, but I'll leave that for the next video to go more in depth. just an overview of the different education programs we offer around the community, kind of run the gamut as far as the basics of Alzheimer's, knowing the 10 warning signs, and then more in depth with how to better communicate with those with the disease, knowing what planning steps to take down the road and so forth can get pretty comprehensive. And we also have workshops that offer several programs in one day and location so that people have the opportunity to have maybe 1 or 2 different sessions given to them. Early stage programs for those that may or may not require dependence fully on a care partner, but we do want to make sure that they know that there are programs and offerings available to them as they're just getting their feet wet with what to do next as far as care plans and so forth. And then we also have education conferences around the state every year. Our largest one is typically in the spring here in Indianapolis. And we do have some caregiver symposiums in different areas. We do offer CEUs for those that might require them. And it's just a wonderful way to come for a day of education, respite, support. And just so you're aware that if you're interested in learning more about any of these opportunities, you can go to training.alz.org to learn more about those different types of programs. In e-services, we have plenty of different ways that we can support people online. Alzheimer's Navigator is kind of like our care consultation where folks that visit that can complete a survey to really know what next steps as far as maybe what questions to ask a doctor, what things they may need to prepare around the home and so forth. All Connected and I Have Alzheimer's Disease are both social networks of a sort for those that are caregivers or have a new diagnosis of Alzheimer's disease. Comfort Zone is a GPS-based safety parameter system where you can set up different areas for those that tend to wander and be alerted when they might venture out of your set parameters. We do have the e-learning, as I just talked about, at training.alz.org. And the Community Resource Finder is our national Angie's List type service where you can find support across the nation and search by zip code to really find what local resources are in your area. The Alzheimer's Association has really been a part of every major advancement in Alzheimer's research since the 1980s. And we have awarded nationally and globally over $315 million to over 2,500 grants in 1982. The 2011 Alzheimer's Association International Research Program awarded more than $12.8 million in research funding to 78 investigators from 8 countries. We've really had a handle on research and see it as a critical step in finding a cure and helping pave the way for future generations. And Trial Match is just one way that we try to help with the research aspect of our mission. And we know that there's lots of groundbreaking research going on that can have a measurable impact on the lives of current and future patients of Alzheimer's disease, but we notice there's major lack of volunteers for clinical trials. And because of that, it's significantly slowing down the research and development of new Alzheimer's treatments. So we do have what's called Trial Match. It is a connecting service where you upload your health profile and it would match you with any current or future studies that you would pre-qualify for. we really can ask people to consider filling out a trial match card, or you can register online at alz.org, trial match. Researchers are looking for individuals with the disease, family members, and healthy volunteers. You do not have to have a diagnosis, nor do you have to be a current caregiver. We just need to have a larger pool of participants for our scientists. Another thing I do want to note about that is that Trial Match connects you to services that may or may not be drug-based. There are many different types of social surveys that you can take online that will help with journal articles. So it's not just medicine related, it's not necessarily brain scans and so forth. There are all kinds of different types of studies available through Trial Match. And this slide here really shows the mission of the Alzheimer's Association and the different arms that our priorities are aligned with. So if there's an area that you think you would best fit, I highly encourage you to consider looking at one. Meaning that increasing concern and awareness would be more of the communication side of the association. If you're skilled at writing or public speaking, we would love to talk with you further. Maybe if you have a personal story you would like to share, we'd love to speak with you about that. Advancing public policy, we have many opportunities, as you'll find out in the next video. We'd love to talk with you about helping us make a major difference on Capitol Hill. Accelerating research, just spoke about Trial Match. Again, it is a wonderful way that you can be a part in finding a cure for Alzheimer's disease. There's really no obligation to sign up. You would be responsible for then, if you pre-qualify for a study, to sign yourself up for that. Enhancing care and support is really the direct care portion of our association. So if you really have a passion for helping people that are currently struggling with care plans and what next steps to take, this would be an area that we would really like to talk with you further about. And last but not least is our growing revenues to meet the mission. So if you like helping plan events, if you're skilled at logistics, we would love to speak with you about maybe joining one of our committees or helping us stay up at one of our fundraising events. And please, if you are interested in volunteering with the Alzheimer's Association, take a few minutes to watch the next video to learn more about opportunities and really get more in depth about what things we could have you get started with. Thank you again for your interest. If you would like to contact us further, we'd love to online. You can visit us at alz.org/Indiana/volunteer. or give us a phone call at 800-272-3900. Thank you.